And we are live. Hi, good evening, everyone. Welcome to Level Up Live. I am Dr. Sharita Gaskins-Tillett. I am your host. Welcome, welcome, welcome. We're so happy that you're here this evening. I have a special treat for you guys. So, this particular episode is actually by request who asked for a particular subject matter. And so, if you guys ask, I will answer. And so, tonight, this is the answer to that. So, we're just going to give a few minutes for other people to come in and then we'll get started. If you're watching us live, say hello in the comments. If you have questions, please type them in the comments. If you are watching the replay, hashtag replay, and still ask your questions, I will forward them. If you are watching on YouTube, we are now streaming to the private Facebook group, YouTube, and LinkedIn. If you're watching on YouTube in particular, please like and subscribe and share the episode. So, I'm going to introduce my special guest this evening. So, I have joining me tonight Dr. Malini Khanna. Dr. Khanna specializes in the non-surgical management of spine and sports injury. Dr. Khanna has been a practicing physician for more than 10 years in the South Jersey, Philadelphia area. She is experienced in several procedures that can reduce pain. She specializes in hips, knees, and shoulders. Dr. Khanna is passionate about providing non-surgical. She is able to perform peripheral joint injections, fluoroscopic-guided injections, epidurals, facet injections, medial branch blocks, and radiofrequency ablations. Dr. Khanna has additional training in musculoskeletal ultrasound, which allows her to diagnose and perform precise injections in the area of injury. She has a particular interest in treating chronic tendon problems with minimally invasive techniques. Dr. Malini Khanna received her bachelor's degree from the George Washington University in in Washington, D.C., in biology with a secondary concentration in exercise science. She subsequently attended the George Washington University School of Medicine and Health Sciences for her medical degree. Medical Center in Livingston, New Jersey. She came to Philadelphia to pursue her residency at University of Pennsylvania in the field of physical medicine and rehabilitation. Her fellowship was in sports medicine and interventional spine at Performance Spine and Sports Medicine. Welcome, Dr. Khanna.
Thank you. Thank you for having me.
So, how are you this evening?
I'm doing great. How are you?
Good. I'm great. I'm so happy to have you. So, tell us first, I want to give you a shout out, fellow GW person. I
Oh,
actually did my residency at GW. I graduated from residency at GW.
oh, I didn't realize that.
Yeah, yeah.
Oh, I wonder if we overlapped. We'll have to ask.
Oh, well, we'll talk about that later. I can't tell years on here, no.
Yeah.
So tell us about you. Tell us about your journey through medicine. How did you end up, specializing in sports and spine?
Sure. So I kind of went to medical school, kind of really unsure of what I wanted to do. So I went through the whole gamut of like, okay, I'm going to be an OB-GYN. And then I did that rotation. And I was like, wow, that's really hard. Then I wanted to do pediatrics. And then I got sick from all the kids. So I was like,
Yeah.
that's not going to work. So I actually started off in anesthesia and I started the first year in anesthesia. And then I had a change of heart halfway through the year. I did a pain rotation and I knew that I could stick with anesthesia and eventually do a pain fellowship, but I just didn't want to go through 4 years of anesthesia. So I actually switched to physical medicine and rehab. And it's kind of a unknown field. Like I actually didn't even do a rotation in medical school in PM&R. So I just kind of stumbled upon it after medical school. And then I realized, oh, this is kind of a cool field. You can do rehab of all sorts. You could do stroke rehab, you could do traumatic brain injury rehab, you could do sports rehab, spine rehab. And so it kind of just fit better with my personality. So that's how I ended up in PM&R. And then I thought about doing the pain fellowship, but then again, I was kind of conflicted on, do I really want to be doing narcotics? Do I
Sure.
really want to be doing the high level procedures, which are interesting, but kind of came back to like I really do like the sports side of things. So then I stumbled upon a really awesome fellowship that did both. We did spine and sports, and it really trained me quite well for what I do. So that's
Okay.
my
So,
journey through
so,
medicine.
so tell us what you do now.
Sure. So I actually just started my own practice. It's called Concierge Spine and Sports Medicine. I do treat a lot of lower back pain. So majority of my patients are lower back pain, and then I have a handful of patients that are sports injuries. So they may not be actual sports injuries, but you can get tennis elbow from typing too much. You can get golfer's elbow from using your arms too much. But a lot of overuse injuries
Sure.
is kind of like into the sports category. So I just started July 2022, opened my practice. I have a lot of experience working with orthopedics. I worked at an orthopedic practice for almost 10 years and then decided to venture off on my own, just because I do things just a little bit different. So
Okay.
this that's why I decided to start my own practice.
So you say you do things a little bit different. Tell us what's different about you. What will patients get when they see you that they won't necessarily get elsewhere?
Sure. So, my passion about treating back pain is to really give you treatment same day. The way the insurance structure is right now is that you go see the doctor, you go physical therapy for 6 weeks, and then get an MRI, and then maybe get an epidural. So, I really not everyone fits into that model, but every insurance wants you to fit in that model. So I will order the MRI sooner than later. I will also, someone has an MRI that's done already and they have an obvious pinched nerve and there's no way they're going to get to physical therapy. I want them to get the epidural same day.
Okay.
So
So you kind of streamline the process.
yeah, I want to see people get better quicker. I don't want the insurance driving medical care. And that's kind of what's
Sure.
happened, unfortunately. So if I see someone in pain, I just want to get them on the table, put the medicine right where the problem is. And then this way, they don't have to go on heavy duty narcotics or nerve painkillers or extra
Right.
medication. So that's kind of my goal. And when I was employed, I would get a lot of pushback from the staff because they didn't want to do the authorization same day, or just didn't want, they weren't set up to do same day injections because they would have to pull staff from another doctor. So, now that it's my own practice, I kind of run the show and I'm like, no, we're doing the authorization now and get in the room. We're doing the injection right now. This person's hurting.
Yeah, yeah, exactly. I think that's very compassionate. And I think, patients will appreciate that because it will get them back into life sooner.
Yes.
I was doing some research in preparation for this interview, and, back pain is really a huge deal. I think the numbers were anywhere from like 15 to 40% of people experience some form of lower back pain in those under the age of 45, it's the number one reason for disability. And so
Mhm.
you think about that, you have that this is a huge population of people that are not able to work. So if they're on disability, we know they're not getting 100% of their salary. And so it's putting a financial strain on their families, on their coworkers, potentially, having to pick up the slack. The sooner you can get people back to work, I'm sure the better for them.
Yeah. Absolutely. Yeah, I've seen the statistics like as high as like 80% of people experience back pain at some point in their life. 4 out of 5 people. I think it's closer to 100%. I think at some
Yeah,
point we all have back pain. We're upright humans.
yeah,
We walk
absolutely.
around.
Yeah,
So,
yeah. I understand. I actually have scoliosis.
mm,
So I've had back pain most of my, some form of back pain most of my life. So I know it well.
yeah.
So tell us, What causes back pain? I guess let's start with that. So many of us have it. I have a reason for mine, but what causes a lot of the back pain that you see?
Yeah, there are so many causes. That's probably why it's so common. Um, the biggest one that I've seen during COVID is the working from home and being inactive.
Mm,
The posture, sitting at the desk, like we all kind of like slump forward and we get kind of really into our computer. So we got to make sure our posture, feet have to be flat on the floor. I'm even doing it right now. Crossing our legs is really bad for you, but it's just we get comfortable
yeah,
crossing our legs.
yeah, sure.
So continuously crossing your legs is not good for you. People that are smokers, the nerves and the blood vessels in particular get narrowed with smokers, as we know, and you get less blood flow to the back, and then you can have really bad arthritis. So smoking is linked to lower back pain. So every smoker that comes into the office gets a lecture.
Wow, that's interesting.
Yeah, so smoking is a big one. Stress, of course, again, stress, we all like sit like
Yes.
this, we gotta relax ourselves. Lifting. So I see a lot of work comp cases where someone was lifting something too heavy, or I've seen my own father lifting those like polar water bottles that he shouldn't
Yeah.
have and tried to put it on the what do you call it? Like he tries to put the water bottle
Sensor.
on the thing.
Yeah, yeah.
And he herniated a disc and pinched a nerve really bad. So just people who travel and then they lift their heavy luggage and they come back from vacation in a lot of pain. So lifting is a huge, huge cause of lower back pain.
So
And
do
then
you think it's so much? Do you think it's the or do you think it is the way in which we're lifting things?
I mean, I think it's the weight of the item that you're lifting, but yes, of course, the proper mechanics do make a difference. So if you have a really strong core and proper mechanics, then you're safer than someone that's got a very weak core and then bends does not bend their knees when they lift. So it doesn't matter if you have the best mechanics in the world, if it's just too heavy, it's going to put a lot of
Sure.
stress on your back. And
So you're saying that if we strengthen our core, though, it actually is protective toward our backs.
absolutely.
Okay, and so tell us about the core muscles and maybe some of the things that we can do to strengthen those.
Sure. The core it's all about core. So, when you have strong cores, all that pressure is pulled forward, so away from your back into your belly. Um, so one of the core exercises I recommend, or I even have my kids do, is a chair pose against the wall. So if you've ever
Hmm,
tried that,
yeah.
you can really feel your like whole body contracting, your stomach contracting. And you try to do competitions of who can sit in the chair the longest. So you can get your
So
kids
kind of
into
like you mean like a wall sit?
a wall sit. Yeah,
Yeah,
exactly.
okay.
A wall sit. So that's a good way to get your core stronger. Planks, as we know sit-ups will do it. But really the number one thing I recommend for prevention is yoga. Yoga
Mm.
is the best thing for your back because you get the core exercises, you get the flexibility exercises, and you get some mindfulness too.
So
So
now is yoga something that you can do if you already have a back injury?
you can if it doesn't aggravate it. So usually we ask you to modify the poses if you're finding that it's irritating to the back. Some discomfort is okay. Like, if you do have a little bit of scoliosis, you're probably tight in the way you're curving. So that side is probably tight. So if you can stretch it and it's like a good stretch, like a
Mhm.
would hurt is what I always call it, then it's okay to do. But if it's obviously causing numbness or tingling or shooting pains, then you modify the yoga poses. But absolutely, you can do gentle yoga if you do have mild back pain. But again, if
Sure.
it's severe and you can't get through the pose, then that's when you need to come see me.
Yeah. Yeah. Interesting. I would not have thought about that. What are some other things that people can do to maybe help with the back pain?
So, quit smoking if you're a smoker. Hydration is also very important. I mean, these are things that like are so easy, but we forget. Your discs in your back are made up of water. So if you're
Hmm.
hydrated, they're going to flatten. So you got to make sure you stay hydrated. It's good for a lot of body parts, but for your back. Um, and then weight. If you're overweight, you're going to have more stress on your spine. So making sure that you are, at a comfortable weight. Everyone has a different level,
Sure.
but we all could lose a few pounds here and there. Um, Eating healthy is also very important. So I always challenge my patients and fruits. Just give me 2 fruits a day is what I tell them. Like I see a lot of people
Yeah.
that eat out and they love their fast food. And I said, just give me 2 fruits a day and stop adding extra sugar into your diet. Put the fruit instead of the extra sugar. So take sodas out of your diet, take uh, sugar out of your coffee or tea, and eat an apple and eat some grapes. That's all I ask. And
So
that's how
now
I get
the
started.
sugar, is the sugar more about the weight, or is the sugar have some kind of inflammatory component?
For me, if for when I started, it's more for the weight because that's the first
Okay.
thing that I want them to kind of start focusing on if they're having chronic back pain is the weight. Yes, and then once they're better, then we start to get into anti-inflammatory diets to to maintain the relief. But just like it's also hard to talk to people about lifestyle changes when they're in so much pain.
Sure.
So I try to make it basic as possible. Drink some
Right. Yeah.
water.
They can't hear you until they stop hurting.
Exactly. So try to do the most basic.
So we do have a question. Dr. Tawana Gilliard is asking, does chair yoga work?
Yeah, absolutely. I do also recommend that for the older patients that can't get down on the floor, which is very common. A lot of times they can't get up. So chair yoga is a great alternative to doing mat yoga. So absolutely. But if you can get down on the floor, you should be doing regular yoga.
Okay. All right. Now, you said it also has to do with how much weight we're lifting. Is there an upper limit that you recommend for people in general?
Again, it's kind of it's based on patient to patient because you'll have patients that come in that have to lift 100 pounds for their construction job, and they need that, they need those restrictions of no, like, they need no restrictions to get to work. Uh,
Sure.
so it really depends, my I usually say like 20 to 50, depending on patient to patient. Like if you're older and frail, I usually say, okay, no more than 10 pounds. Uh,
Sure.
Middle-aged and you're someone that works out a lot, then, I would say 50 pounds. It's so dependent on patient to patient and what they do for a living and how healthy they are and again, how much pain they're in.
Okay. Now, do you recommend back supports? I see a lot of those things like the belts that weightlifters use. I know as an OBGYN, oftentimes we would recommend back supports for in our pregnant patients. Is that something that you support as well?
In the beginning, uh, so when they're having acute flare-ups, absolutely. Um, do you, prescribe, like, the SI belts for the pregnant women, or do you
Sometimes it just depends. It depends on what their particular issue is.
okay. So when they're having a lot of acute pain, the back braces can help, especially if it's shooting down the leg and then you just kind of, like, pull in the abdomen, it can help, while they're walking, but then you have to release it when they're sitting. I don't recommend it long term. Like again, it's fine if you're lifting, like if you have a job that's lifting that like can kind of suck it in and it makes you pay attention to your like mechanics better. That's why you see all these people wearing them because it helps keep everything tight and then they bend properly and then their core is activated. Um, but long-term use, like on a daily basis for someone that doesn't do a job that's heavy lifting, I don't recommend because your muscles will actually get used to it
Mhm.
and they get weaker.
I
So
see. Okay.
we don't recommend it for long-term use, but short-term acute flare-ups is fine. And then to assist someone that does a heavy load on a daily basis. If they find it comfortable, it's fine to use, but I always tell them you got to work on your core regardless.
Yeah. Well, we actually have a comment in the chat. Someone says, I lifted a chair when I was pregnant. It still bothers me 13 years later. And they also go on to say, lifting is the thing that has helped me the most. So, lifting weights.
Yes. So if you do it in a controlled environment, that's different than doing it in like a, where you are moving heavy furniture without stretching. But yes, that would be kind of more exercise, like physical therapy. You can do some lifting, but yeah, so that can help. Again, if you do it in progression where you kind of build up the strength, it can help because it's a type of exercise. But yeah, when I'm talking about lifting, I'm talking about the lifting that you're not ready for.
Sure, sure, sure. So now if you wake up and your back is tight, is, kind of you tweaked it or something like that, what are some of the things you would recommend that we do at home before we seek care?
So at home, I would try kind of the typical rest, ice. You can't really compress your back, but you could wear a brace. You can't really elevate your back, but rest, ice. I usually like ice for acute flare-ups, because you're usually on fire is what I put it. So put the
Mhm.
ice on to take the fire out. Some people prefer heat. Um, there's no right or wrong when it comes to ice and heat. So if you alternate it, sometimes that can help. So I would say if you're having pain, put some heat on it, do some gentle stretches. The one I like the best is cat and cow. You just get on all
Okay.
fours, you do your cat and cow,
Yeah.
and then ice it afterwards. So heat, stretch, ice, and then you can take anti-inflammatories if you don't have any contraindications to them. So ibuprofen, or you can take Tylenol if you can't take ibuprofen. And then you're allowed to take rest, but you're not allowed to do bed rest for more than 1 day because
Okay.
then that actually makes you weaker.
Sure.
So I say, 1, maybe 2 if it's really bad, but after that, you've gotta get up and walk around and get your blood flowing. And then, if it's ongoing for 3, 4 days, then, come in and make an appointment to see a doctor or, if it's really bad going down your leg, then urgent care would be somewhere to go, and then they'll a lot of times refer them to me if it's really bad.
Okay. So now you say that you do lots of non-surgical treatment of back pain, and actually that is your preference. What are some of the things that you do?
Yeah, so for leg pain, epidurals are great. I use the X-ray, so you can actually put the medicine exactly where the nerve comes out of using the X-ray and the techniques that I've learned. So epidurals are great. I also do facet joint blocks, and that's for arthritis pain. I also do it for scoliosis pain. We block the joints that are causing pain, and then you can actually burn the nerves in the spine, the nerves that go to the facet joints. You can burn those nerves and actually give you some relief. The only problem with burning nerves, I wouldn't even say it's not really a problem, but it's common is the nerves grow back, and
Yeah,
then
I
you
was just going to ask if it was a permanent solution.
yeah, they grow back, and then you come back maybe 1 or 2 years later and get it burned again. So, I have patients that come back every couple years, and I get to know them over the years, but while it's burned, you feel really good, and then I really encourage you to do the lifestyle changes at that time, and that's when I have those talks with you, like, "Okay, we gotta cut back a little bit on, the lifting if you do a very heavy duty job, or we gotta, clean up your diet, or we gotta work on anti-inflammatory diets." So that's the time I kind of push that, and I really push the smoking. You got to quit smoking if I'm going to burn your nerves. I really want you to quit
Yeah.
smoking because you're just going to come right back.
So now, can you tell us a little bit about the anti-inflammatory diet that you recommend?
Yeah, I mean it's I follow Dr. Wheel's diet. With Are you familiar with him?
I'm not.
Okay, so it's basically again, it's it's using stuff that we all kind of know about. So turmeric, using more turmeric in your diet, um, antioxidants like blueberries. We know that you need to have blueberries. Taking gluten out of your diet because gluten can cause a lot of inflammation. And then you can also look into taking dairy out of your diet because some people have a dairy intolerance and they don't realize it. So it's again just goes through eating your fruits and vegetables, eating more nuts, um, more, and then the grains is kind of switching out the gluten for quinoa or those other gluten free that are skipping my mind right now that you can
Sure.
use and and just trying to see what could be a trigger because if you take out the dairy and you find out that I feel a lot better, I'm not less bloated, and then that helps just overall pain in general. um, so those are kind of the biggest things for the anti-inflammatory diet.
Okay. So now we've been talking a lot about backs, but you don't exclusively treat backs. Tell us about some of the other things you do.
Sure. So I also um, I treat a lot of sports medicine patients. Like I said, they end up being more overuse. So one of the things I've really got specialized in is chronic tendon issues. So
Hmm.
tennis elbow, golfer's elbow, rotator cuff tendons. I've even done Achilles tendons, patellar tendon. So these tendons, if you overuse them, they get scarred and they get thickened and they can get calcifications in them. So I specialize in a procedure where I use a needle and I use an ultrasound and I go in and clean out the scar. So it's a minimally invasive procedure. It's a procedure that I would highly recommend before going through any major surgery for tennis elbow. um, Now, if you have like for a shoulder, if you have a complete tear, it won't help with that. But if you have calcifications in your shoulder, then I can go and break up the calcifications and pull out all those calcium deposits and have much less recovery time than a typical surgery can. So I really like this procedure. It's called a percutaneous tenotomy,
Hmm.
and percutaneous meaning on the outside, and then tenotomy is meaning the tendon. So I love cleaning out people's tendons, and people do really well with this procedure. So I offer that in addition to everything that we talked about for the lower back.
So now is that something that would treat, say, frozen shoulder?
No, not no
Okay.
frozen shoulder. Yeah, that's just you got to go for physical therapy for like 9 months. Frozen shoulder is a tough one. Um, that you can do steroid injections for that, but sometimes they don't work. But yeah, this is more like rotator cuff issues. Like I said, tennis elbow, golfer's elbow, patellar tendon, chronic issues, Achilles tendonitis, and then it can be done for plantar fasciitis. But I don't generally treat feet, but um, I have done it on a few people that have requested me to do it for their plantar fascia because that can get really scarred and with too many cortisone injections, that's an area that this procedure does work on.
Okay. So now after people, do you see people who have had surgery already, or do you mostly see people who are kind of going down a path and hoping to ward off surgery?
Yeah, I'm more of a physician that you'll see to try to prevent surgery. So once you've had the surgery, usually will refer you to maybe a higher level pain doctor that might do spinal cord stimulators for your lower back. Or if you've already had surgery for tendon issues, there's unfortunately not much I can do at that point. Um, but there's always we can always try some type of injection. Another thing that I can mention that I do also is platelet rich plasma therapy. So that's called PRP. That's where you take a sample of your own blood, spin it down, and suck out the platelets, separate the platelets, and then we re-inject platelets, which have regenerative growth factors, back into an area of injury. So sometimes I'll offer that if you've had surgery and you're just still not where you want to be. Same, even if I do the percutaneous tenotomy and you're not healing, then we can offer this PRP treatment to go in and try to regenerate some of the tissue if your healing is a little slow. Or we just do this alone if you don't want to go through any kind of surgical treatment, and you want to try a holistic, natural approach. This is a nice alternative because it's your own blood. There's
Sure.
no other medication involved.
So how effective has that been found to be?
Again, it's like kind of anecdotal. Like I've seen it work so well on some people and you just don't know why. And then you see it on people who you think are the most ideal candidate and it doesn't work on them. The science is not exact yet about how to separate the platelets from the plasma. It's very individualized, and
Sure.
like I said, it is very holistic. So that part you have going for you, and there's really no risk to injecting your own blood. So there's virtually no risk. But I've seen it work where people couldn't lift their arm because they had a tear in their rotator cuff. We did the procedure and they came back and they're like, "Oh, I can lift my arm." And I'm just like, "Oh, that's amazing. Like that's great.
Yeah.
This is why I do this." So it can work wonders to ineffective. But usually it does something. Like it usually does help something. Like you do get a little benefit out of it because it promotes regeneration and it
Correct.
does cause an inflammation into the area. So more blood gets recruited and usually it does help, but 100% to we have, 10% to 100% results with the PRP.
Yeah, I like what you do. You mentioned kind of a holistic approach. And, you've talked to us about diet, you've talked to us about lifestyle changes, you've talked to us about drinking water. So I think, it just goes back to the importance of having a healthy lifestyle in general to, promote health and to promote our health. So, and who would have thought necessarily that would be such a huge factor in mitigating back pain.
Yeah. It's just from experience of seeing patient after patient, doing it for 10 years and just, the experience of that. It's not just injection after injection. You've got to change lifestyle. Otherwise, they come right back.
Yeah, yeah, I can see that. So we're just about out of time. I have a final question that I always ask. And so for this, if you want to, if anybody who's viewing wants to up level their back care, what is the single best thing you would recommend them do?
Yeah, I think I already answered this, but I would get you into yoga. Get into
You
yoga.
did say that, absolutely.
Yeah. If you
Okay.
want to up level your back and you want to have prevention and treatment, start yoga. You can go on YouTube right now and download something. I have 5 exercises on my website that you could do every day and start there if you wanted to. And but yeah, yoga.
Well,
That's
speaking of your website, why don't you tell us how to find it and also tell us where your practice is located, the exact address.
Sure. So my practice is called Concierge Spine and Sports Medicine. The exact address is 1200 Constitution Avenue, Philadelphia. It's easy to remember. And I'm in the Navy Yard part of Philadelphia. If you're familiar with that, that's right near the stadiums, right next to the Eagles stadiums, and all the other Sixers and all the sports complex area. And my website is www.cssmpa.com. So that's Concierge Spine Sports Medicine Pennsylvania.com. And I would love to treat anyone that's suffering from back pain that they just haven't gotten the right answers, or anyone that has a chronic tendon problem, or any non-surgical orthopedic issue I can handle.
And potentially be treated the same day.
Yes,
so,
yes,
so
absolutely.
check her out. Well, thank you very much for joining us. I appreciate you sharing your knowledge with us. I appreciate all of you for watching with us. I do want to just remind you that registration is still open for our weekend retreat, A Weekend for Me. It's being held March 24th through 26th in Cambridge, Maryland. You can get more information at www.aweekendforme.com. But don't delay because early bird registration is ending on Friday at midnight. So this coming Friday at midnight is the end of early coming. Register today. Also, we have limited space available because we want to keep the size intimate. So again, thank you for joining us, and we will see you next week. Thanks, Dr. Khanna.
Thank you for having me. This has been fun.